Sleep is the condition of the body and the mind when it's at rest and our nervous system is inactive. A person should receive about 7 hours of sleep every night in order to have a good memory, a good mood, proper cognitive functioning, secretion of hormones, a good immune system, a regular body temperature, and a strong renal function. A person who doesn't receive adequate of sleep every night can experience irritability, depression, or difficulty concentrating. The stages of sleep begin with NREM sleep. NREM stands for non-rapid eye movement. The first stage is when the person falls into light sleep and also the muscles begin to relax here. This stage only lasts for a few minutes. The second stage is when the person falls into deeper sleep. The brain waves are high here, but they also begin to slow down. This stage lasts 10 to 20 minutes. Then we move on to stage 3. Stage 3 is the beginning of deep sleep. This is when the brain produces slower delta waves. Dreaming can occur here, as well as slower respirations and slower heart rate. This stage lasts 20 to 40 minutes. Then we move on to stage 4. Stage 4 is the deepest stage of sleep, and this is obviously when it's harder for a person to wake up. This stage lasts approximately 30 minutes. Then we move on to REM sleep. REM stands for rapid eye movement, and this is when dreaming actually occurs and the brain waves are active as if we were awake. This stage lasts approximately 20 minutes, and all of these stages repeat in a cycle every night when we sleep.
Insomnia is when a person has a hard time falling asleep or staying asleep throughout the night. It can be short-term, lasting for a few nights, or it can be chronic, lasting for months. Transient insomnia may cause from stress, excitement, or a change of sleeping pattern, whereas chronic can be from underlying medical, behavioral, or psychiatric problem. Depression can also be a factor of insomnia. A person with chronic insomnia should seek a healthcare provider who specializes in sleeping disorder. Sleep apnea is when a person stops breathing for a brief period while asleep. There are 3 types of sleep apnea. We have obstructive, central, and mixed complex. Obstructive apnea is the most common type, caused by a relaxation of the soft tissue, which allows partial to total obstruction of the airway. A person with obstructive apnea will have visible respiratory effort, which causes the person to wake up, to draw breath before falling back to sleep. It can occur multiple times of the night or multiple times per hour. Central apnea is caused by a failure of the brain to communicate with the respiratory muscle. As the oxygen saturation decreases, the person will resume breathing. So it's less common than obstructive apnea. Mixed complex is the combination of both central and obstructive. Obstructive apnea may be treated with CPAP or BiPAP. Is it a device with a small compressor that maintains airflow through the mask or nasal prongs while a person is asleep? If the device is not tolerable, then surgical procedure may be required. Central apnea does not respond to CPAP, so there are other available treatments. Snoring or harsh sounds is from a vibration or obstruction of the airway passage at the back of the mouth and nose. May result of poor muscle tone, excessive tissue, or deformities. Obstruction may be related to cold or allergies, or it can be a symptom of sleep apnea. So get a good exercise or lose weight if needed. Or another recommendation is to sleep on your side instead of your back. But remember, it can be a symptom of airway obstruction, so I will suggest to go ahead and seek a specialist just in case. Narcolepsy is a sudden onset, uncontrollable, brief episode of sleep during normal hours in a well-rested person. It can happen any time of the day, from few seconds to more than 30 minutes. It starts at the age of 25. There's no cure, but there are drugs and behavioral therapies are proven helpful. Exposure of bright light and regular exercise are also recommended. Stimulant medication are often used to prevent daylight sleepiness. The diagnosis of narcolepsy is evaluated by clinical evaluation, a sleep log or diaries, and a lab result from a sleep test. So these are the 4 sleeping disorders.
Many factors can disrupt the normal sleep cycle. Some common factors are people who work the evening or night shift. They usually find it difficult to sleep during the day. Workers who change shift during the month also find it hard to adjust to get adequate sleep. Students often study at nights, in which getting enough sleep could be a problem. Travelers may suffer from jet lag as they go through different time zones. Sunlight exposure for several hours helps to reset the internal clock. People who snore or have a partner who snores may be awakened frequently during the night. Consuming caffeine, nicotine, and alcohol can interrupt the normal sleep pattern. Caffeine and nicotine can delay the sleep process, whereas alcohols may cause you to be awakened during the night. Regular exercise can make a person sleep, but too much exercise or taking a nap close to bedtime can prevent one from falling asleep. Illness and stress may also interfere with the sleep because it causes a person to worry, in which keeps them awake or awake them during the night. Also, old mattresses may be a factor in not getting enough sleep because of the lumps and not getting enough support from the mattress. Environmental factors that affect sleep are the room being too cold or hot, too noisy, or too much light. For instance, being in a hospital, a person may be interrupted because of routines that may cause noise, require light, and administering medication or treatment.